Hi, I'm Sam Kuna, and this morning we want to have different perspectives from different professionals. Yeah, I know the most uncomfortable one is to call the pastor a professional. Yeah, okay, but 2.5 years ago, there was a mental health survey that was done. I think Seng Lee mentioned about it, and that created the thrust of this mental health conference for pastors. Yeah, because the focus was on what are pastors going through as they serve in full-time ministry. And so we had more than 400 respondents, and there were some concerns for pastors who indicated that over the past 12 months, they experienced depression. A significant percentage said they experienced having suicidal thoughts, and they even considered leaving the ministry. And these were people who were pastors and full-time ministers who in the previous 12 months felt like giving up. And so that was the impetus that started the conference. Last year, because of the COVID restrictions, we couldn't have an exclusive session like this. That was the initial plan. So we're very thankful that One Farrer Hotel was willing to bring forward the booking. All right, we made the booking and we brought forward the booking, and we are so glad that we are able to see all of you here. So this is an exclusive session just for you because it is our concern and our desire to reach out to pastors and to reach out to churches to let us know how mental health professionals can network with you, yeah, to support you and in your personal ministry, as well as to give you support to the church community that you are responsible for. Yeah? So before I introduce the speakers, I want to look at a set of slides that I have. And so the first one, I think, how many of us identify with the first one? Okay, things to do, right? You got lots of reminders of things to do. You got your personal schedule and diary, and it's all marked out. Yeah? And usually that's the way pastors operate. This next two slides, a survey that was done in April this year with pastors in America. Yeah? And the question they were asked, I'm only going to show two. Which of the following aspects of your personal life as a pastor need attention or investment? And the highest priority was time management. No time, 24 hours is not enough for pastors. Balance, this word was mentioned earlier. Children, marriage, caring for aging parents, financial stress. Yeah? This is personal life. Okay, the next one, next slide. Which aspects of self-care, and that was the focus this morning. Number one, exercise. Dr. Tan, you said you wanted to show us the moonwalk. I mean, how to walk. How to walk 10,000 to 15,000 steps a day, right? When you're talking on the phone, walk. Yeah? That was one of the tips that you gave. Avoiding overcommitment, and Valerie said, learn to say no. Yeah? Her husband David learned to say no. Eat right, taking time for hobbies and interests. Play, that's it. Play, hobby and interest. Consistently resting, yeah? Sleep. And then, of course, facing on. 13% have chronic illness among the pastors. Yeah? So we are going to ask the panel to respond to this, this American survey. This is April this year, right? So how does this reflect on us as ministers, as pastors, and as professionals, right? We have different perspectives, So Lisa is an educational psychologist. Abigail is a counselor. She's a play therapist. Yeah, so she knows all about play, Chang Yang. All right. She's the president of the Play Therapy Association Singapore. Yeah. Okay. And then Pastor Adrian is pastor. He knows all about pastoring. Yeah. And he can respond specifically to some of these aspects. So, what is your initial response? Yeah, to the as a mental health professional? What is your initial response to these findings? And what advice or guidance would you give to pastors in Singapore churches? So I'll start with Lisa. Yep, Sam.
And also thanks to all of you for just inviting me here. I'm really, really honored and humbled, to be in the presence of godly men. I shall be, blessed, okay, when I leave here today. So I think Sam was sending this information to us on what the findings are. And I think one of the key issues here we need to be mindful of is also cultural differences, right? So in the US, definitely the culture is yes similar but yet quite different.
What is this?
And I think for Singapore, if you ask me, this is not unexpected. In fact, if this is done in Singapore, I think it might even be higher in terms of the percentages, of the things that that impact them, things that they need to pay more attention to. So I like to just go back to the slide. If you can just go back to the first one. Or rather the first chart.
Who's going back? Yeah. Thank you.
Yeah. Okay. So you've got a time commitment and you've got that balance thing, right? I think Dr. Tan has already shared quite a bit about that balance. It is actually what's the word? Elusive. I mean, it's not even going to happen. All right. So let's not work towards that. But I think it is about. It's about being able to also attend to things that matter. And I think as an educational and child psychologist, I see a lot of children and a lot of families, and a lot of times they actually stress not about themselves. Okay, so maybe the pastors, you've got very good mental health, but sometimes part of your mental health is actually affected by your family's mental health, and especially children. And I think you heard that also, Pastor, Valerie, right? That having children with developmental issues, the research has just came out, right? That your risk of having mental health for parents are actually 5 times more than if you do not have children with special needs. So again, those of you who do have children with special needs, do take care of yourself, because you are at risk in that sense. Yeah. So I think that it's about paying attention to what matters. And I think when we talk about mental health, because I was looking at this, right, what I really like is the fact that, okay, 1/3 of them talk about children, pay more attention to children.
Yep.
So this is a personal testimony as well. My husband was in full-time ministry, out in the missions and doing, response relief, disasters relief responses.
Yep.
Okay, and so I had, I have 2 kids. They're a lot older now. So my son is 19 and my daughter is 16. But when they were younger, it was a very tough time. Yeah, and I think with the father not being around, and I think many of you, because of your heart to serve the ministry, you are often not around as well. And I think we also heard from Reverend Kong, about absent parents or maybe absent family coming home to an empty home. And I think those are the things that really do affect our children. And I think that it's very important that we do pay attention to them. And I can tell you, really, one of the key protective factors is actually relationship. So our children really need to have that core relationship. Yes, relationship with God is important. But when they are younger, you are the person that they need to have relationship with. So and I think with absence, people tend to say, quality time is better than quantity, but I think we do need to have that time spent with them. So it's about carving the time, and when you are there, it is about full presence. Wait, I need to answer this first. Somebody in the cell group has got something. Wait. So it's not that. It is really about the presence, and I think what Pastor Valerie has shared as well, it's really about listening. Really about listening. I asked my daughter, I said, hey, so what is it that you want me to share? She said, Mom, can you please tell them communication is very important. And it's not a one-way communication. Pardon me, pastors, it's not about preaching to your children. It's about listening to them and knowing where they are and building that relationship with them. Because that relationship, I can tell you, is going to help them through the difficult times that they will face. So those are the things that I just want to share. I shall not take time too much, but thank you very much for listening.
Thank you.
I think just running on what Lisa was sharing, I think when I first looked at the chart and the words were like in fine print, so the question was in fine print, so I was a bit squinting. And I think at the initial glance, for me personally, it looked pretty much like any other helping professional and the struggles of a helping professional. And I think when I think through the lens of pastor, one of the things that stood out for me is really the multiple roles and responsibilities that a pastor has to take. And maybe one of the differentiating factor in that is that for myself as a mental health professional, I have certain clients come to me. After that time, it's like, please go for your social support, don't call me. If anything, crisis, you have all the emergency numbers to go to. However, for pastors, it's almost like you are on 24/7 emergency call. And if you don't answer a message, you get scolded. And then if you answer and you show up, and it's like, how come you're not fast enough? Or how come you don't show up and you don't attend? Or if you send somebody else, why did you send this person and why did you come in person? So I think there's a lot of hats that pastors actually have to put on. And while in terms of when we talk about self-care, we would like it to be very linear. Step 1, do this. Step 2, do this. Step 3, do this. And if you go week by week, this is what you do and we get an outcome, and I think we all love that. However, I think just like what Dr. Tan was saying this morning, we all go through different seasons in our life, and in different seasons, perhaps there are some things that are more important and more of a priority than others. At times, it might be you're just starting to build a church and there are certain needs of the church that you need to attend to or to a ministry. At other times, developmentally, your children are growing up and there are different milestones that family plays a more important part. So how do you then kind of navigate through the seasons and what's important during those seasons? So as an encouragement, I think it would be an encouragement for pastors to receive encouragement and support. That's one thing. In terms of looking for safe people, be it peers or people who have maybe walked the journey a little bit longer than you, safe people where you're actually able to go to be yourself and to just share your struggles, and like what we heard this morning, to go to someone who is able to be a listening ear. And while we acknowledge that that's important for pastors, I also just want to share that it's also equally important for those of you who are married, your spouses, and also for your children. Because while you may be at the forefront in terms of pastoral work, many times the family is part of that picture. And for children, and like Lisa, I work a lot with children and families. That's the whole play therapy thing, and it's not just for children, it's also for adults, because neuroscience tells us that it's important that when we play, there are very positive neurotransmitters and chemicals. So I'm just encouraging all of you all that you have full permission today and tomorrow to also play, right, and laugh. And children, when they are growing up, they are very concrete thinkers developmentally. So they have to deal with, on one hand, growing as a child into a young adult and to an adult, and they have to navigate through developmental challenges, including identity. So it's that individual identity, while yet at the same time, there are many different labels that they can actually have. Pastor's kid, elder's kid, deacon, so-and-so's child. And for children who are concrete thinkers, it's very difficult to be able to differentiate that. Who am I supposed to be? What am I called to do? and you tag that on in terms of like relationship to God and what does the Christian actually mean. And I think if there's an advice that I can give to pastors, one, receive encouragement, look out for safe people, not just for yourself, but also for your spouses and your children, and also learn to enjoy your time, be it whoever you are with. If you are with, we still talk about being present. If you are with your congregation member or if you are with your leadership, enjoy those moments. If you are with your family, enjoy, connect with them. And I don't want to show of hands, but I just want to just maybe encourage all of you to do a little self-reflection. When was the last time you smiled and you really had a party? So I just want to encourage that if there's been a while, I just want to encourage all of you to just find some time to experience that.
Thank you. Yeah, to the pastor, yeah.
The pastor here is very blessed hearing. I suppose Abigail is one of those, when she shares this, by the way, she's not just sharing from a theoretical or professional point of view. I think more than just being a professional, she's also a friend. And I think maybe that's what I would say has been instrumental in, for myself at least, keeping that reality check of who I am as a person. Pastoring doesn't define me. I think pastors, to me, I see myself really as a representative of all the pastors here today. I think you need friends who play with you. Well, you get what I mean, right? Friends who you can just take off that pastor hat for a moment and be yourself, a person. And here's one of them to me. She says what she says, and she practices it as well. She would invite me and check in with me every couple of months to make sure, hey, you doing okay or not, hey, you need coffee or not. She's made coffee for me before. Just to also hear from me and to be that safe space. I think pastors, we need friends outside of our church communities to have that kind of safe space. And I think also then, one more thing we have to say is, we also, in our members in our churches, let's also do life with them. I think time for members may not always be ministry in a one-way direction, but exercise with them, run with them, have a game with them. I think that kind of life and life, at least for me, it helps to release that pressure that, I'm here to always minister, but I think we want to share this life together, and when we do so, we are each other's fellow confidants in that sense. So I think this is just what I would perhaps add to all of this. I agree with Dr. Tan Siang Liang. The balancing is even this evening, I can't make it for a night session because someone passed away and I have to attend up to be awake this evening. That's the reality of pastoring. But then, friends in church, to just play together with friends outside of church, really helps that community to keep a pastor afloat and thriving in joy in ministry.
Thank you. Okay, the doctor is in.
Sorry, apologies for disappearing. Exigencies of service. Likewise, like pastors who have to disappear. Hey, when I was listening to this and looking at the survey results, it tells me that all the helping professions, whether you're a pastor or whether you're a doctor or therapist, face the same kinds of challenges. And if we are not careful, the biggest challenge to me is setting your priorities, going back to your basics. If you don't take care of yourself, or if I don't take care of myself, then I'm really not very useful to other people. I remember when I was first working in Woodbridge Hospital, it tells you how old I am, that time it was still called Woodbridge Hospital. One of the senior doctors told us that, in all the other professions of medicine, we give pills and then people get well, or we do operations and people get well. But in psychiatry or in helping professions, you are the pill. So I said, I'm a pill, okay. And that's also true with with the pastoring, sorry, and helping professions. And so if we don't take care of ourselves, so now I've actually gone into a mode where I actually deliberately limit the number of clients. There's a never ending, by the way, there's a never ending number of people who would like to see you or spend time with you or to gain information or benefit. But sometimes you have to put a limit to it and say, and if you notice, one of the biggest problems was time. And so I've taken it to start to manage my time schedule by saying that they say, can you meet at this time, or I need to send somebody. Just now while we're here, there were already 3 WhatsApps asking whether they can see it. The key here is they say, sorry, my schedule doesn't allow it for that time. And sometimes the schedule is that I'm going to have a nap, but we won't tell them that.
Of course, yes.
And you know,
You schedule for yourself.
That's right.
Yeah.
Self-schedule, either a nap, take dogs out for a walk, go for exercise. And you know, now one of the things, in addition to giving medications as a psychiatrist, most of the time it is the basics. And the people who can follow the basics best do better than those who just take medicines. Basics meaning go for a walk every day, go for a walk. I've had people who have gone for everything from ECT to things, and when they came and see me with a dozen different medications, I said, okay, let's try taking it off and let's go back to basics first, so that I don't even know what we are treating you for sometimes. Go for walks every day or every other day at the most. The Canadians are very good at analyzing this, and they say that if you walk for 30 to 40 minutes 3 times a week, after 6 weeks it is equivalent to taking a Prozac a day. So not bad, you know, you get the effect of having the antidepressant and the anti-anxiety movement, which comes naturally. The same with eating right and not waiting until all your gastric juices are telling you that you're burning a hole in your stomach before you have a meal. Okay, so same thing. So eat right, exercise right, spend time with the people who are important, because at the end of the day, as you've noted, it's the family who's going to be the ones who are going to be there for you most of the time, okay? So it's going to be family, and spending time to be able to engage with them and be there for them is vital as well. Sleep.
Yes.
Sleep, very important. And you know, sleep doesn't always have to be at night.
Guess where he was a few minutes ago.
When I used to attend board meetings at the Institute of Mental Health, some people used to ask me whether I have developed the talent of being able to sleep with my eyes open. It's a very useful talent. First you use toothpicks, and then after that you take away the toothpicks, it still stays open. No, but what I'm saying is that for people who find it difficult to sleep at night, and then don't overthink the issue that I'm not getting enough sleep. Take a cat nap. Cat naps, you know, like Winston Churchill and all these other brilliant people, it helps you to restore some balance. And people think that I have a couch in my office for examining patients. My staff know better. Okay. It comes with nice cushions and pillows for me. But you know, sometimes when you have a half an hour, 1 hour break or things between times, just put my head down and rest.
All right.
Thanks.
Okay, thank you. I hope you've been taking notes. Yeah. So go back to basics, and what was the other one?
Sorry, I've forgotten already.
Okay, never mind. Go back to basics, and of course, sleep. Yeah.
Sleep.
Yeah, sleep. And communication.
And family.
Yeah,
and
family, as well as play, and then love life.
Friends.
Yeah, friends, and love life. So, it's so important to take note of things that you can put into practice, not just conceptual. For this conference, it's not about what you're going to learn and then teach others. No, get something that you can do for yourself. That's what this is all about. Yeah. So I have a second question, and if we can go back, there were 15% who said none of these things in the first question, and there were 10% who said none of these in the second question. So I asked the panel if they had any thoughts for those who are outside of that few parameters, and none of these affect them. So what is affecting them? What are some of the other possible areas?
Yeah.
Okay.
You want me? I can answer first. I start first, okay, for change. Penance for coming late. I remember this term that I learned in medical school. It's called alexithymia. Have you ever heard of that? Well, in the good old days, they thought that the thymus gland was the control of all mood and affections in your body. And so dysthymia means you're feeling kind of down. Euthymia means you're feeling okay. Alexithymia is something that a lot of people have, but it means I don't even know what I'm feeling like. Basically, no clue. How are you feeling? Don't know. And this is a question that we ask in Singapore quite often. So when I ask my clients, how are you feeling? They say, normal.
Yeah.
And I look at them, normal, your
It's
normal, my normal, very different, okay?
Yeah.
I think.
Yeah.
So what do you mean when you say normal? Normal means normal. No, is there emotion? Are you feeling angry, sad, happy? What? Don't know. And there are many people, including pastors, who have tried to control so hard that after a while they don't even know what they are feeling. And that's scary, because when you don't know what you're feeling, if you know what you're feeling and I'm feeling sad or I'm feeling angry, then you can have a solution, or I can go and look for help. But if I don't know what I'm feeling, then it's very difficult to get help.
Very good point. Very good point. Yeah.
I think that is so true. I think as pastors, we have our members who come to us because they hope for some clarity. There's this spoken, unspoken expectation to hope that pastors can answer my deepest, darkest questions or needs, and others can help shed some light on what I'm going through. And I think the reality, so far for me to explain why, but I would say there are oftentimes pastors and ourselves as well. We don't know why we think what we're feeling, because there is so much that's coming. We know that there are seasons where we feel we drag our coffee to work. There are seasons that we sometimes feel that, why is everyone telling me their problems?
Yeah.
Why am I solving other people's problems? Don't you also recognize that I have my own problems, but not fully grasping why am I feeling so irritable or short-tempered, etc. Perhaps the only thing I would suggest is sometimes we ourselves need that space to say that it's okay to not fully understand as well, and to allow that season. And that's something when we see other people just to bounce off, retreat to think through things. For ourselves to get clarity sometimes. So it takes a season to allow ourselves that time to have that season. And I also think that one of the principles that I hold so dear to my heart is that God works when, even though we feel that, or we think that He doesn't seem to be working. He is working, both in other people's lives and even my own life. I give myself space to remind myself also of that reality. Yeah.
Thank you. Thank you. Yes, Lisa or Abigail?
Okay, interesting that you talk about emotions, because that's actually one of my research area, and I really truly believe that I think one of the protective factors, because when we talk about mental health, right, okay, it's actually a spectrum. It's not about whether you have mental illness or not in that sense, but you go from mental well-being, which includes all the things that we talked about, the basics, to mental distress, to mental illness. So at any point in time, it will be there. But one of the protective factors, to either prevent you from getting there, or that if you are there, how do you manage it? is actually the social emotional competence. So our ability to actually socialize with somebody, we have that relationship with somebody. But at the same time, what's important here is actually our emotional competence. Yeah, and I think Sam was saying, to give you some tips, right? So since I'm an educator, I was a teacher for many years as well. I thought maybe I'd share with you a very simple tool or something to just kind of remind yourself when you have that time to take time off. How can you reflect or what are the areas that you want to say develop yourself in when it comes to emotional competence? And it's a very simple acronym that forms RULER. Not to hit yourself, but to rule. So it starts with R. So the first step is really to recognize there's a bodily sensation. Very often we blow up and then we realize, I shouldn't have done it. Right? But actually, there's a lot of bodily signs that will tell you that you are already growling. I think just now, again, Pastor Valerie shared about that. Noticing what is it? Oh no, I think it was Pastor, I think it was Daniel who shared about how his wife was able to pick up these signs. And if you can pick it up yourself, okay, my heart is pounding. By the way, my heart is really pounding. Or that I'm, getting very fidgety.
Yeah.
Or that I'm irritable at what he said. These are signs to tell you that something is not going right. And it's okay that it's not going right. It's just a sign. So that's the R. Okay. Then with the U is then you then need to take time to understand why. So that you don't get angry over and over again about the same thing and you have no idea what that thing is. Right? And what is it that is making you upset? And just a quick one, usually people get angry for two reasons. Number one is that your goals are not met. So you've got to ask yourself, what is the expectation that's not met that's making me very upset? Okay, and number two is provocation. Who is it that's poking on to me? I think just now again it was shared. Who keeps poking on me? What is it that's being poked on me? Can I put a stop to it? So until and unless you know what is it, awareness is the beginning change.
Yes.
And we cannot manage that which we do not know. So we need to first and foremost be aware, right? Why are we getting upset? Why am I anxious about? Okay? Then the L, you need to have a label. I think Dr. Rizzo said, how are you feeling? You know what the kid's favorite phrases are?
Okay.
Like that, I don't know. Like that.
Like that.
It's really bad. So they have no language and no vocabulary to even begin to articulate. So if there's anything, we got to educate ourselves on these words, and there are many out there. Anger is not just anger. You start with irritation, you start with, then you go on to frustration, and all the way up to rage, right? So having that whole spectrum of vocabulary will allow us to, the fourth one is E, express. And pastors and fellow colleagues, expression of emotions is actually very important. And I think in our culture, we have a lot of suppression.
Yeah.
You cannot be so angry. Why are you so angry?
Yeah.
Right. So I think we do need to allow people to feel safe enough to express. And for those of us who have got angry teenagers at home, by the way, teenagers are very often angry, right? And they'll come home and then they and you get upset with them. How can you be this way? You're being so rude.
Yeah.
But can I just give you one advice or one tip? Really, if your children come home and they scream and yell, rejoice. Because that means they feel safe enough at home for them to be able to express.
I missed two already.
So the emotional expression is very
What's R? First R?
alright, because when they can express it,
Remember.
the last R, they don't need to do that much, which is to regulate. Very often when we talk
Regulate,
about emotions, right, we say, anger management.
Regulate.
It's not that management or the regulation. If you can do the rule, you don't need the very regulation. But of course, when emotions are intense, you do need to have these strategies as well. So RULER, R-U-L. That is very simple. Okay.
Very good.
I just wanted to say that she just listed out all the others that I really want to say. So obviously, I think kind of talking out loud. And I think one of the things that stood out to me was that so much of it is about doing. You know, and I know, okay, I know that we'll see it soon. And it's cliche, but I think so much of the emphasis is about the doing, like what can we do as pastors, as leaders, mental health professionals? What about the being part? You know, and when we talk about mental well-being, how does that look like? And it's going to look very different from individual to individual. And more than I think just the self-care, it's also about the soul care. We talk about, you know, building our faith and the spirit, but we also need to build our soul and ensuring that our soul is healthy as well. So I think just to kind of add on to what Lisa shared about being aware of our emotions, many times, and I think in a culture like ours, many times we grow up and when we are born as babies and as infants, there is an external regulation. When we cry, somebody brings us milk. When we cry, somebody changes our diapers. And isn't it interesting when they become toddlers at 3 or 4 years old? Wait! Keep quiet, go and come down. And then when you are ready, you come and talk to me. When we have not really been taught, how do we label, acknowledge what's going on the inside of you? Have someone come alongside to teach us co-regulation so that when we grow and we experience all of the emotions that come up for us, and can I just say that it's a myth that having emotions and, you know, depression, anger, anxiety is bad. They're not bad. They are an indication that something is going on the inside of us. And when we are able to be aware and when we recognize it, it doesn't extend into something that is maybe more problematic. So if we are able to, maybe even amongst ourselves, even though we are adults, don't be ashamed or afraid to say, maybe I've never really been taught how to regulate my emotions. That maybe I need to speak to somebody to just learn how to regulate and manage my own emotions. And it's okay. And that's what this conference really is about, to provide a platform where it's a safe space for all of us to just discuss and say this is where we are at, and can we get some help and support one another, so that we can all not only self-regulate, but we can be that impartation we can impart the same thing to others from about us who did it.
All right. Thank you. So if you learn something out of the second question, you don't say, I don't know. Right? Starting from, that's basically what I say, right? So when we feel something, or when there's some destabilizing experience that we go through, find someone safe that we can talk about it. Yeah. And I think that's what I gather out of this second question. Okay, it leaves me now to ask you to, let's thank the panel for their contribution and a little gift from the organizers.